RSV season has started. RSV usually starts in the fall and lasts through the winter and into the spring. My name is Dr. Monica Flores, a pediatrician in South Florida since 2001, and this is my patient education on RSV, respiratory syncytial virus, a common cold virus that in older children and in adults produces runny eyes and nose, itchy, painful throat, fevers, cough, body aches. But in toddlers and infants, RSV can be severe, life-threatening even. It can produce a profuse amount of mucus that can plug up the nose and lungs, and swelling of the lungs, of the small airways of the lungs, producing bronchiolitis, bronchitis, and even pneumonia. It could also cause high fevers and decreased appetite. Have your child evaluated if any respiratory infection produces a progressive cough in frequency or intensity, a cough that wakes them up from sleep, makes a child throw up, or produces a whistling noise, known as wheezing in their chest, or congestion in the nose that rattles into their chest and makes it vibrate. When in distress, young babies will grunt or flare their nostrils with every breath. You could also see retractions, which is above their sternum or in between their ribs. It will pull in as they breathe. In older children, you can use a pulse ox to keep an eye on their oxygen. RSV is usually diagnosed in the doctor's office with a swab in the nose, and because it is a cold virus, it is not treated with antibiotics. Instead, I recommend that parents and caregivers use saline drops in the nose, which are over the counter. No prescription is necessary. And suction. My favorite method of suctioning is the nose Frida for infants and toddlers. Older children and adults can use saline rinses. A nebulizer that mists the saline can be useful when children have colds. Control the fever with Tylenol and ibuprofen if your child is old enough. Give lots of fluids. Don't worry if they don't eat, but they must drink to replenish the fluids that are lost in the mucus and in the heavy breathing. RSV can cause asthma exacerbations in asthma-prone children. These children may need albuterol, nebulized or via an air chamber, steroids, inhaled via an air chamber, or oral. RSV is extremely contagious. Any cough or mucus from the nose will pass the infection on to other people. So if you or your child has a cold during the holiday season, please stay home. Don't share the germs, just share the joy. Thank you.